I'll share my screen. Beautiful. And there we go. Let me just get this in slideshow mode. There it is. All right. So really excited to present on this topic to your crowd in particular, just because all of the kiddos that you work with and that the parents are, bringing to you are right up our alley. They're the ones that we absolutely love to work with. So today I just wanted to talk about some of the different things that are at play when people are struggling with different cognitive and emotional challenges. We're going to talk about different brain patterns that are underlying some of those things. And we're also going to talk about what we can do about it. So my goal is that everybody would have something to take away from this that they can actually implement right away, as well as some additional ideas for tools, interventions, all of that. So we get to talk primarily about the brain, which is my favorite topic. I am a total neuro nerd. So we'll just dive right in. And I just wanted to start by just talking a little bit about what's been going on with our youth these days. Probably not a huge surprise to you all, but these are all statistics that have been taken between the years of 2019 and now. So it seems like we've been having more and more of these mental health challenges happening and learning challenges going on with all of that. So, what they found is that about 50% of the different adolescents these days have experienced at least one childhood adversity. These are from the Adverse Childhood Events, ACEs. And so that's quite a lot these days to have experienced one out of the 9 that they classify to be significant traumas. So we've got about 50% experiencing trauma. About 42% have reported feeling persistently sad or hopeless. 31.9% have been diagnosed with an anxiety disorder. 20.1% experienced clinical depression. 13 diagnosed with ADHD. 10% attempted suicide, and 22% seriously considered it. So as we know, this is a huge issue in our adolescents these days, and 10%, 10 out of every 100 have attempted suicide. That's pretty significant. And this is, again, just within the last 4 years. So we also see a lot of concussions happening with the different sports, car accidents, other things that are getting to our little fragile brain. And then 5% were diagnosed with actual post-traumatic stress disorder, which is something that a lot of times we don't see diagnosed until adulthood, and we're seeing more and more adolescents starting to exhibit these symptoms. So that's the problem. And then we are all about getting to the roots of what's going on, especially with things like trauma, when people are continuing to experience the detrimental effects from the trauma years after the traumatic event occurred. Then we need to look at, okay, what's causing these symptoms to continue? What's causing them to continue suffering? And also what's behind all of these different mental health challenges and cognitive challenges and everything that keeps popping up. Daniel Amen is a big brain guru, and he's written some really good books on the matter. And he has a quote where he says, "Psychiatrists are the only medical specialists that virtually never look at the organ they treat." And I would go to say that this is actually all of the mental and cognitive health fields. They tend to do testing and symptom assessments, but they don't actually look at the brain, which is really at the root of what's causing a lot of these symptoms. So we do look at the brain, and I want to just give you a little bit of an intro on how to look at the brain with the different brain waves and the different technologies that we utilize that are out there at your disposal to be able to see what's at the roots. One of these is called electroencephalography. So that's the EEG. These are the squiggly lines that you tend to see on all the movies. And so you see these slow brain waves or delta brain waves. These ones are usually going up to about 3 Hz. So they're usually the slowest ones that we look at in the awake brain. And so we tend to see these a lot when you are sleeping or unconscious. The slower the brainwave, the less conscious the brain state. Okay. So we don't see a whole lot when you're awake, but you should have a certain amount. It's kind of like that underlying current of the brain. It's like I consider it like the heartbeat of the brain. Okay. Then you've got theta. This is the stage usually right before you fall asleep or right as you're waking up. You tend to see more of these theta waves kick in. So it tends to be a little bit more of a drowsy state, a little more spacey, checked out. We tend to see this, of course, a lot with like an ADHD inattentive type where they're often la la lands. These can be theta brain waves. Okay. And same as delta, we want a certain amount when you're awake, but we don't want too much, okay? They do have some positive benefits as well. They've been associated with things like creativity and memory. We just want them in balance, okay? Then the alpha brain waves are the next step up from there, usually around 8 to 12 Hertz. This is a nice sinusoidal wave, so it just goes up and down, pretty even. And this brainwave has been associated with more of a relaxed state. It's a mid-range wave, so it's not as spacey as theta. You're awake, but you're in a very relaxed internal state. We also tend to associate alpha with states of mindfulness or flow states. So when people are, doing artwork or dancing or in a sport and they just kind of lose track of time, a lot of times this is an alpha state. Moving into the beta brainwaves, these are the faster brainwaves. So this tends to be a more active brain state. So we need these if we're trying to focus, we're trying to get things done, we're listening to the teacher or doing our homework or doing our chores. We want these beta brainwaves. They keep our brain active and aware of what's going around. However, if we get into the too fast beta brainwaves, then you can imagine that's an overactive brain state, right? Now, you need those to kick in if you are actively problem solving, or, if, for example, you're exposed to a threat, a car's coming at you, you want to jump out of the way. These fast beta brainwaves help you do that. So again, no bad brainwaves. These are good. But if we get too much of them, then we start to see things like anxiety or rumination or whatever those brain regions are responsible for. You get too much of that. Okay. And then we have gamma brain waves. These are a fascinating brain wave. They're one of the least well researched just because you have to happen to catch them when they pop up. And so they've been associated with things like aha moments and bright ideas out of the blue or integration of thoughts and ideas, but they just tend to come in bursts. You don't want to see these persistent throughout the entire EEG. Usually when we see that, it's associated with things like a seizure disorder. Some cases of autism and bipolar can show this, or it's actually an unstable brain region when it is getting too much of this. So those are the main brain waves. And then we see something like this. And this is what a raw EEG looks like. So this is a combination of all these different brain waves mixed together. Each of these lines is correlating with one of the sensors that we have on the head. And we get to see the overall patterns that are happening in the brain. And then we take all of that and we do what's called a quantitative EEG analysis. So the quantitative EEG is where we take this person's brain waves and we compare them to others their age who are healthy, high-functioning individuals. We consider it neurotypical, okay? So this is going to show us what is outside of that range. Now, as we know, that's not always a bad thing. There can be some really beautiful things with that. So we are going to look at the whole big picture. We're going to make sure that it's matching up with symptoms or things that are getting in their way. But we have found that a lot of times, if people are showing some of these like red colors, that would mean they're producing more of those brain waves in those brain regions. And more often than not, it actually can get in their way. It can create some challenges. And often we find that as things move a little bit more towards the center there, this is kind of like the bell curve. So the center of the bell curve people tend to feel better. They tend to really be optimized cognitively and really just able to do what they want to do in life. Okay. So this is our scale that we're looking at. We look at the oranges and the reds would be the too much side, the darker blues or the not enough side, and then we look at the ones around the green. Those are considered to be kind of the optimal range. Okay. We also look at connectivity metrics. So we won't go into too many details about that, but this is essentially looking at how well brain regions are communicating with one another, how much synchrony is there, how balanced are they with one another, and what is the timing from point A to point B. We also break all of that down into individual frequencies so we can get super specific to exactly what each person's brain needs, what's going on. And then we get a lot more specific with something called the SW Loretta. Okay, the SW Loretta is one of the newer, more advanced technologies in this field. And with that one, we're able to break the brain down into really specific regions. So each of these regions is a functional region of the brain. They have their own functions. So rather than just saying, okay, this is frontal lobe, we can say, oh, this is actually coming from region 44. And region 44 has its own functions. So we can get a little more specific to what is going on in this person's brain. How might that be showing up for them? And then we'll talk about how we address that. This is what it looks like in real life. So it's a 3D imaging, and we get these beautiful images that show us where the activity is coming from the strongest, and then kind of that ripple effect that goes out to other regions. Now, one of the game changers with the Loretta technology is not only are we getting a lot more specific, but we're also getting deeper down in the brain. So the traditional EEG could only show us about this top layer of the cortex. And if you have an activity deep down here, it's going to have a ripple effect. And that ripple effect is going to get bigger and bigger and bigger as it gets closer to the scalp. So you end up with a big old chunk at the top, and you don't know where it's coming from. With the SW Loretta, we can get really specific and say, oh, it's coming from that little point right there. Okay. So these are some of the technologies that we're using. We can also look at connectivity metrics with this one, and this one's going to be a little more accurate because it is more specific. So we can see where regions are overly connected, and we can see where they are underconnected. So all of that to say, if you are having a kiddo that's struggling with some things, I really encourage you to seek out this Loretta assessment. It's going to give you a lot more specific details that give you a little more guidance on what's going on and what they're needing. And then, of course, like I said, we want to match that to symptoms. So we know which brain regions are associated with which symptoms, what patterns show up with each thing. So we look at that whole big picture, the whole person, and then we determine what we can do to really help them feel and function at their best. Now, one of the things that is facing our youth that actually faces all of us, unfortunately, is stress. Stress is one of those things that we can't really escape. But when we have chronic stress or we have traumatic stress, we're finding that it can have a lot of detrimental effects. So one of the things that we've found is that it actually interferes with the development of the brain. So for example, if somebody is being exposed to some kind of traumatic stress while their brain is still developing, their brain's going to develop around that trauma, right? It's going to develop with whatever strategies it's using in that moment for the trauma. But sometimes, as we know, those strategies don't really serve us later in life. So for example, the brain might learn like, oh, the world is not a safe place. I need to keep this fear center fired up and hypervigilant all the time. Maybe that worked in the moment, but later in life, it is actually contributing to things like anxiety that are starting to get in our way. Okay. So that's one of the pieces. We've also found that it even changes not only the function, but the structure of the brain. It can have trickle-down effects even on our gut, on our immune system. It can contribute to inflammation, lead to adrenal exhaustion and fatigue. And we're seeing it at the root of a wide variety of different physical and mental health ailments. So when we're talking about getting to the roots, this is another root that we're looking at. We want to see what's going on there. On the neurological level, some of the things that we see related to this stress is that it impairs specific regions that are responsible for some pretty important things. So one of those is the dorsolateral prefrontal cortex. So that's this top left one. We're seeing that this brain region is responsible for a lot of our executive functions. So when it starts to get dysregulated, then we see impairments in our attention. We see that we have a hard time controlling impulses and controlling certain behaviors because that part of our brain is supposed to be regulating those for us. This part of the brain is also involved in things like working memory. It's helping us with goal setting and future-oriented thinking. It's helping us with abstract reasoning. So again, all of those things can get impacted just by this one region getting impaired. We also see that orbitofrontal cortex can get dysregulated. This can lead to things like low motivation. This is partly involved in our reward response. So it's going to affect our learning and our behaviors, which are motivated by the rewards. We see our insular cortex, which is where we have a lot of our self-awareness. It's also responsible for our attention to things like pain or threats, as well as pleasure. And we find that the insula tends to get a little bit biased when we've been through a lot of stress. It tends to overly focus on the things that are potentially painful or threatening. And this isn't just physical, this is also emotional pain. And so it focuses on that. It tends to kind of ignore the other stuff. So it's unfortunate because it causes us to feel the not so comfortable stuff a little bit more strongly, and it makes it harder for us to feel the good stuff. Okay. So we definitely want that one working at its best. Broca's area is where we're able to express ourselves through words. So when this one gets impaired, then it can make even things like psychotherapy more challenging because we can't really get the words out to express what we're feeling or experiencing, especially in the moments that we're kind of triggered. These are just some other examples of regions without going through all the details here. We also see some of these subcortical regions. So the hypothalamus, for example, this is what triggers our entire stress response throughout the body. So that's going to cause the increase in heart rate or the butterflies in our stomach or our face flushes. That's all triggered by the hypothalamus. The amygdala is also like our little watchdog. That's the one that's detecting the threats as they come by. And when this gets hypersensitized in the case of this chronic or traumatic stress, then we see that it tends to be like the dog barking at every car that goes by. So we find ourselves getting triggered more and more frequently. And with that, we actually unfortunately become less able to distinguish what's truly a threat or not. And sometimes we don't even know what the triggers are anymore. We just get this chronic anxiety. And then the hippocampus is largely known for its involvement in memory and learning. So this is also one that's really predisposed to being affected by stress. And unfortunately, that's going to make things like school a little more challenging because it's harder to really take in what we're learning. Okay. So those are just some examples of how stress can be at the root of various different challenges. And then we've got our whole nervous system. So the brain doesn't stop with the head. It actually goes all the way down to the tips of our fingers, the tips of our toes. And this nervous system has these two primary branches. One of those is the sympathetic and one is the parasympathetic. Sympathetic is known as like the activation or the stress response. The parasympathetic tends to be known as more of a relaxation response. It's known as like the rest and digest response. However, parasympathetic in excess can lead to things like dissociation, where we're kind of checking out as well. So these two branches we also want to have in an optimal balance with one another. So, looking a little more specifically at the brain, we've seen various different patterns that associate with different challenges. So, for example, with the anxiety or PTSD or just this chronic hyperarousal, we tend to see these back parts of the brain a lot of times get fired up. Okay. It's almost like they get stuck on all the time. And so it can cause us to be having that fight or flight response over and over, as opposed to what it's supposed to do, where it just kicks on when we need it and then it goes back down. So we tend to see this process where it goes up and then it doesn't quite come all the way down, then it goes up even more, then it doesn't quite come down, and it keeps going up until our baseline is now way up here. And if this is our tipping point, then we only have a teeny little fuse before we're over the top. Okay, so this is really common to see this kind of a pattern with anxiety or PTSD. And this is one where we would want to calm that down. Now, if this goes on for a really long time, sometimes we see the flip side of this pattern. We see where the body actually burns out of some of that stress response. So, for example, we have a stress hormone called cortisol. And when we are experiencing that stress response, we release a lot of cortisol. Cortisol is, it gets a bad rap because it's known as a stress hormone, but it's actually part of completing that stress loop for us so that then we can return to a baseline. But when we have too much of that cortisol circulating, it can create these compensatory mechanisms in the brain where the brain's like, oh my gosh, there's too much of this. I need to start shutting down my receptors, which are like the catcher's mitts for the cortisol. So it starts closing those off so that it doesn't get too flooded with cortisol. And then the body and brain detect that, and they're like, okay, well, we should probably produce less cortisol. And then we get triggered again. We release all of it at once. Then it shuts down even more. We produce even less. And then over time, we become deficient where we don't have enough of it. And then this can lead to this exhaustion. It's one of those where it's like you're tired all the time, but then you get triggered, you still get that really high response because you don't have the cortisol helping to regulate that. And then you're depleted again. Okay, so this is another pattern we tend to see, especially at later stages. Dissociation, again, this is, it shows up in many different ways. So one of the ways it shows up is we feel like we're detaching from our body, right? So in extreme cases, you see people talking about like, I was looking down on my body, right? This is oftentimes showing up as an excess of slow wave. So it's almost that like dreamy state. And it happens in some of those sensory regions or some of our cerebellum. These are two regions that connect us to our body. So if those are going half asleep, then we feel disconnected. Depersonalization is where we actually feel like we're not ourselves, right? We feel like, wait, I'm not Ashlie, right? It feels off. And so this one we tend to see in more of this frontal part of our brain that has our sense of self. So a lot of times we see our adolescents these days struggling with knowing who they are. And that part of our brain is really important in that process. And then another piece of this is more of the emotional side, where sometimes we see like this emotional numbing or shutdown. And that also tends to occur in some of those emotion centers of the brain where they produce too many slow waves. So those are some examples of brain patterns we might see with dissociation. Depression also has many different patterns that can show up. This is just an example of one of those patterns where we see more of a depletion. So we call this a blue brain, and it tends to be more on the sad, down, low energy, low motivation, right? Now we see this little spot here is where we have the most deficiency. Okay, so the least amount of activity. And that part of our brain is related to our mood and our mood regulation. So when we see that deficiency, then we tend to lean more towards sadness. Okay. ADHD. ADHD is a biggie that we're seeing a lot these days. I actually think that ADHD can be a huge strength. There's certain personality components that are really beautiful with ADHD. There are also some things that really get in people's way, where, for example, they might have all these beautiful, creative ideas, but then can't actually accomplish all the steps to get there, right? Or they're going too many directions at once. So this is one where we tend to see one of the most common patterns is that we have an excess of slower brain waves in these anterior regions, these frontal regions of the brain, again, related to a lot of our executive functions, attention, planning, organization, decision making, impulse control. All of those reside up here. And so if we're producing too many slow waves, that means it's going too slow. It's not kicking in the way it needs to. Okay, so oftentimes that will manifest as ADHD symptoms. Now, we also sometimes see the flip side. Sometimes we'll see too many fast brain waves. And that's what I consider more of like the squirrel brain. So the brain is now seeing everything is relevant, everything needs to be paid attention to at once, and then we're very distractible. Okay. But sometimes that can also lead to like the hyper focus side where we can really zoom in on one thing, but then we have a hard time shifting our attention to something else. Autism is another one where we have many different brain waves, or I mean, brain patterns. Um, Autism, in my opinion, isn't even just one thing, and there's so many different ways it can manifest. And a couple of the patterns that we tend to see that get in people's way the most are we see this excess of faster frequencies in these sensory integration areas. So this is where all of our sensory information, what we're seeing, what we're hearing, what we're feeling, all of it comes together to form a picture for us of our world. And when they get overactive, then we tend to see this hypervigilance. We tend to see hypersensitivity to sensory stimuli and really difficulty with processing and integrating that sensory stimuli. We also sometimes will see an excess of slow waves within the regions where they're really struggling. So, for example, sometimes with autistic savants, we can see this really incredible gift. And then we see, struggles with more of the everyday stuff like brushing our teeth and tying our shoes, right? So in the region where we have the huge strength, we might see a lot of power and we see a lot of connectivity in that region, but then the others are kind of getting robbed and we might see a little bit more of the slow waves in those regions. And then we see a lot of connectivity pieces with autism. Oftentimes we'll see a hypercoherence, meaning too much connectivity. Usually we think of connectivity as a good thing in the brain, which it is. We definitely want connectivity. We want all brain regions to communicate properly. However, when we get too much, it can also be kind of like, well, what it looks like here. It can be kind of like a little jumble, right? Like a yarn ball that's getting tangled up. So we want to help each brain region to be able to function optimally, do its own job properly. We don't need the CEO trying to do the janitor's job and the janitor trying to do the CEO's job. We want each of them to do their own, but communicate as needed. So that's where we see that most efficient, effective flow of processing in our brains. And then TBIs, traumatic brain injury and concussion. this is one that I like to mention because a lot of these are undiagnosed. We have no idea that we even had a concussion. And one of the issues there is that there's this thought that we can do a simple little concussion assessment, especially in sports on the field, where, how many fingers am I holding up? If they say the right number, they're good to go. And unfortunately, that is only assessing one part of the brain, the visual cortex. It's not assessing other pieces that could have been hurt by this concussion. We also have found that these concussions can occur without even hitting your head. A lot of people don't realize that. So, for example, if you're in a car accident, then a lot of times you don't even hit your head, but your brain hits your skull. Okay. So, if you think about it, our brain is like a lump of fat. Okay. It's about the consistency of butter. So, it's a little soft, a little fragile. It's floating in liquid, surrounded by a hard skull. Okay. Now, this is a great system for everyday things like if we're going for a morning jog, then it's got enough cushion for that. It's not going to be bouncing against the skull. But it's really designed for about as fast as we can run, which is about 5 to 6 miles per hour. So if we're even in a 20-mile-per-hour car accident, that can be 4 times faster than what our brain was designed for. And we can have a seatbelt, but our brain doesn't. So our brain can then get pushed into the skull, and that can create some concussion effects. So a lot of times kids will get diagnosed with all these different things, especially learning disorders. And when you look at their brain, you realize, oh my gosh, there was an actual concussion there. And if you actually treat the concussion, you see a lot of those symptoms go away, and they don't have to live the rest of their life with this disorder that they've been labeled with. Okay. Now, the other thing with concussion is that it's really going to depend on where it occurred in the brain, how severe was it, and repetition. So that's one of the things with things like football, right? You're getting hit over and over and over and over again. So even though the hits may not be that bad right from the get-go, it's kind of like if you get a little bruise and then you keep hitting that spot over and over, you're going to get a bigger and bigger bruise because it's vulnerable. So this is one of the areas where I would love to see us providing a little bit more concussion treatment along the way to help the brain recover as it starts to get these hits. And before we add to that bruise, we want to help it heal first. And then this is an example of a brain assessment where we showed a concussion. This was actually more in the cerebellum. This is a common one, for example, if people fall backwards or they're finding that soccer, like headbutting the ball, it actually causes our brain to then hit this bone that curves in the back of our head because the cerebellum sits right on top of that. So it can be a little more vulnerable to that kind of damage. So that's one of the patterns. And then I also have an image down here that shows a light blue where the whole brain is kind of that light blue. That is a low power brain or low voltage. And sometimes we'll see this also in the cases of like high speed things like snowboarding or car accidents, because what happens is you've got the cell body. The cell body is going to move farther and faster than the branches. So sometimes those branches can get pulled, twisted, even broken, and that can create what's called this diffuse axonal injury. So that's another thing that we look out for. And then I like to just mention that our brain is connected to all these other systems in our body. So we find a lot of effects on all these other systems where, for example, with a concussion, they found that within about 3 hours, the gut lining is impaired and we can start to get a leaky effect where things are leaking into our bloodstream before they're fully digested. We see within about 6 hours of a concussion, we change our microbiome. The entire bacteria in our gut can start to change. So this is something that we didn't used to know. And now we're realizing that you don't even have to injure the gut, but you injure the brain and you get all these trickle down effects on the body. And then we start to see things like food sensitivities and heightened allergic responses. We see inflammation, all these other impairments where they start to struggle with physiological disorders. I'm going to actually move through these two examples, but this will be there for your reference. I'm happy to share these slides afterwards. But just since we were getting a little late start, I want to jump into what we can do about it, because I know that's the main reason you're here. Okay, so first and foremost, I wanted to tell you a little bit about neurofeedback, just because this is one of the best tools that I've found to help the brain heal and really get to those roots. So neurofeedback, it uses what's called a brain-computer interface technology. So you've got your brain being read by neuroimaging, like the EEG. It's read in real time, and then the computer is responding to that brain activity in real time. Okay. So with this, we're able to talk to the brain. And in order to do that, we want to use the language that it speaks. So we tend to use audio and visual cues. The majority of the brain doesn't understand rational thought processes. It understands sensory information. So we utilize that to our advantage. And we use cues that are in a form that's also rewarding so that this, kid or adolescent that's coming in, they actually want to come in. So one of the things that's our favorite thing to use is movies. And we connect the movie to the brain activity. So it's enticing to them because they get to choose a movie that they want to watch. It integrates with things like Netflix and Prime and Disney Plus. But the key is that we're connecting it to the brain through this software. So I like to imagine it like we've got all these metrics that we want to train in the brain. So you've got this brain region, we want to increase power, this brain region, we want to decrease, we want to increase this frequency, decrease that frequency, improve connectivity patterns. All of those go into this software of all the different metrics that we want to train towards healthier patterns. And if we imagine those in a big globe, and then we have a smaller globe that's the optimal range of activity for each of those metrics, then we know what we're going towards. So we're starting here. We're going to set a threshold in the software one step in. So we say, okay, brain, if you can bring these metrics one step closer to that optimal range, then you're going to get a reward, a treat, right? So this is where we start to train the brain, kind of like we train a dog. The dog's doing its thing and you push on his back to try to get it to sit. It sits, you give it a treat. Next thing you know, it's bouncing around again, push on his back, get it to sit, you give it a treat. Over time, the dog starts to put two and two together and it realizes like, oh, every time I sit, I get a treat. And the next thing you know, the dog's sitting all the time, every time it wants a treat. Our brain is not that different. Our brain actually learns in the same way and it rewires in the same way based on this reward response. So on the neurological level, you have neuron A, neuron B, you get them to fire together and they start to create connection. So that's where we're using the audio and visual cues to show them the way of how to start firing together. Then they do it successfully and you have, say, the movie that zooms in and the audio stimuli comes in with it. And that's going to tell the brain, like, yes, you're on the right track. And because the kid knows that they want it to zoom in, that is the goal, then the brain is going to interpret that as a treat, as a reward. And then with that, it's going to shoot out dopamine, which draws in these cells that wrap around the new connection to preserve it so that it can remember it and do it again, right? And the more you do that over and over and over and keep pairing it with that reward, then you see that you're able to create a thicker and thicker connection until you have a new superhighway, essentially. So the superhighways are going to be the most automatic processes in the brain. Okay, so this is how we're training the brain to produce healthier patterns, and we're actually getting it to continue doing that all on its own because we don't want them to need neurofeedback the rest of their life. We want them to be able to rewire, get their brain functioning with the best pathways and really feeling good, and then it can continue doing it on its own. All right, so I'm just going to do a little time check real fast because I can't see the time on there. Okay, so we'll kind of cruise through a few more of these. I want to show you the different things. I do want to let you know that if you did need to leave right on time, you're welcome to. We are recording this, so you'll be able to have it for your future use. But I wanted to, before we go, talk about a few more technologies and then also some, apparently this doesn't want to go to that slide, so we'll flip through. We're going to talk about some things that can be done on your own too, that can be helping the brain function more optimally. So PEMF and PBM, this is pulsed electromagnetic frequencies and photobiomodulation. These are two forms of a type of neurostimulation where we're actually using these to increase blood flow and oxygen. We're helping the brain get more nutrients. We can use these to help decrease any inflammation and boost overall brain power. There's something called TDCS, which is a transcranial direct current. This actually affects GABA and glutamate in the brain. So a lot of medications that are given out, especially for mental health challenges or sleep difficulties, tend to work with these neurotransmitters. This one does it more naturally by helping the brain to produce those itself. So for example, if you have an overactive brain region, you can help it produce more GABA in that region, which inhibits, it calms it down. If it's underactive, you can help it produce more glutamate, which is going to boost it up. Transcranial alternating current is more of a frequency. So this is helping speed up regions that are too slow. It can slow regions that are going too fast, and it can put in the frequencies that are deficient. So these are all types of neurostimulation that are all very, very safe. They just kind of nudge the brain in the right direction. I consider it like showing the brain the way. We're not forcing it to do anything. This is nothing like electroconvulsive therapy. We're just giving it a little boost, a little nudge, and then we remove the training wheels and do the neurofeedback to help it continue doing that on its own and really ingrain it for future. So these are just some of the benefits that we've seen, especially with this combined approach of neurotherapy, where we're seeing that we're able to naturally retrain the brain towards these healthier patterns. They're not having to just like grit their teeth and bear it or fake it till you make it. They're actually naturally feeling better and functioning better. We've seen that we can even reverse some of the damage that was done. For example, if there was trauma, we've seen that we can actually teach the brain a whole new way of functioning or help it heal from concussions. We're seeing that mood can be boosted and emotional regulation improved. And then we can get to those roots in the subconscious to be able to reduce our stress and anxiety. So it's not just about using regulation techniques. Yes, we are all about those and we teach all of those. There's even a slide on that, but it's a whole lot easier if it's just not so high to begin with, right? You just don't have so much stress and anxiety at the start. You've got a lower baseline, then you actually have time to implement those coping strategies. So these are just all the different things that we've seen: attention, memory, energy, motivation. All of these things can be improved with the neurotherapy. Now, it's not a magic pill. It does take some time. It is a process because we are naturally rewiring the brain. But it is one of the best things that I've found so far for addressing the neurological roots behind these different cognitive and emotional challenges. These are just some examples that show you before and after images for things like autism, where you see all of this red. And then we do more assessments throughout the process to ensure that the brain is indeed healing, right? I don't want anybody to just have to take our word for it. We want them to see for themselves. And we also want to ensure that it's working. We also adjust the protocols every time so we can keep honing it and honing in on what's left. This is going to be an example of ADHD where we see those slow frequencies reduced in the front. This person's not even done yet, but this is where we're at in the process. Anxiety, that high beta reduces. We see our dissociation where those slow waves are really starting to melt away. So again, green is good here. This would be a TBI that was on this left side of the brain. Those parts were really struggling, and we see that that's almost gone at this point in the process. This would be an example of depression clearing up. This person actually had really severe depression and really significant suicidal ideation. And by the end, they were, laughing, smiling. They got their sense of humor back, which was my favorite thing. This would be an example of what it looks like on Loretta. So we do look at every single frequency and see how those are improving and then adjust our protocols accordingly. And then there's some other things that can help. So neuropeptide therapy. Neuropeptides are basically going to be giving the brain what it needs to produce its own processes. So it's affecting the cells at the mitochondrial level, which are those energy production centers that really control a lot of the cell's functions. So we want to help the brain produce its own neurotransmitters, produce new neurons, new connections. So this is just giving it the building blocks that it needs to do so. Things like biofeedback are really good at retraining the nervous system, works similar to neurofeedback, but it's just helping to train and give that positive reward when those two branches of the nervous system are balancing. We can also work on things like muscle tension and breath training, things like that. We want to, of course, reduce the further stressors, and this includes actual psychosocial stressors as well as environmental stressors. So we found that things like inflammatory agents, inflammatory foods or chemicals, toxins, pathogens, all of these things increase some of that negative stress response in our brain and can exacerbate things for us. So we do look at that whole person. You want to reduce these things as much as possible to optimize the brain. There's our stress regulation techniques. So we love to incorporate those in sessions and really encourage people to practice them in between. So breath is one of the key things we found, just even slowing our breath. It doesn't even need to be deep breathing. Just slower breathing tells our brain and our nervous system that we are safe. If we were running from a tiger, we would be breathing fast, we'd be breathing shallow. So if we intentionally breathe lower into our belly, we breathe nice and slow, that tells our brain like, oh, we must be safe. And so the brain can calm down. We found that things like visualization can also be really powerful, where we visualize the healing that we want to occur. We can visualize ourselves in a safe place. We can even visualize certain physiological things. They found that people can even increase and decrease immune cells just with visualization. So our mind is like the master command center. And if we tell the mind what to do, the mind tells the body what to do. So these are some other things that we found can be really helpful. The other one I want to point out here is interpersonal support. So this is one of the things that I think made COVID so challenging, is people being very separated. They didn't have, well, a lot of them didn't have as much of that interpersonal support. We found that our interpersonal bonding hormone called oxytocin, it's released when we really connect with somebody else. And oxytocin directly counters our stress hormones. It's like Pac-Man that eats it up. And so it's literally a stress buffer. And when we don't have enough of that, then our stress response can be a lot stronger. Nourishing our brain is, of course, important. So, the more natural we can get, the better. Trying to think back to, as close as pulling it out of the ground or off a bush, eating it, the better. Organic is always recommended, especially for what's called the dirty dozen, where the ones that are the highest quantity of things like pesticides and chemicals, our brain does not like those. And so it can produce all sorts of inflammatory effects, and those can be really toxic to our neurons. I always encourage people to taste the rainbow. So really trying to get the full spectrum of colors in your diet, and then eating more on the anti-inflammatory side. B vitamins are also really important for stress regulation. And then these are some additional therapies that I've matched up with brain regions. So for example, if we see dysregulation in the anterior cingulate cortex, we found that things like meditation can be really helpful. Imagery, of course, neurofeedback. We found that the prefrontal cortex responds really well to things like CBT and mindfulness practices. Those are really great. The one thing I'll say with that is that if the prefrontal cortex is really struggling, it's going to have a harder time actually engaging in that or utilizing those cognitive behavioral skills in the moment because it gets overridden by that stress response. So these are all things that can be really beneficial as an adjunct, but we also need to make sure we get to the root. Okay. The hypothalamus responds really well to safe therapeutic touch like hugs. It also responds to things like acupuncture and our breathing exercises. We found that the amygdala also does really well with things like meditation and breathing. It's also really benefited by exercise. So with our fight or flight response in particular, or anxiety, it's designed to make us run or fight. And so the more we can mimic that with things like exercise, the more we help release that in our body. Hippocampus responds really well to yoga is an additional thing that I think is really, really great for our kids and adolescents these days. The parietal cortex is responsible for some of our movement as well. So if we see dysregulation there, doing somatic therapies can be really helpful. Of course, that's where we have our sensory integration too. So sensory integration therapy can be really beneficial. And then the insular cortex is another one that responds to a lot of these same therapies. So those are just some tips to get you started. I'd be happy to connect with any of you and provide any more guidance. Obviously, every individual is an individual, and so we are all about taking an individualized approach. I think that every person has to find what works best for them, what's the best fit as far as interventions and practices and diet. So I encourage you all to help your kids to find what works for them and really find somebody. If you're gonna do a professional, work with a professional, find somebody that's gonna do an individualized, personalized approach, really be able to get specific to what they and their brain and body are needing the most. So that's what I've got for you. I do have a little bit of time. If you have any specific questions for me, then I'd be happy to answer those now. And like I said, we've got this recorded, so I'm sure Emma will be able to get that out for you. So I know we went through a lot of information very fast, but it's there for you for a resource. All right, so Emma, are you there?
I am
Hey.
here. Yeah, I appreciate the presentation so much. I learned a lot. I love being able to sit in on these because I get to learn a lot. And yeah, I will pause the recording here and then make sure to send it out to everyone. If you do want to send me that slideshow, I think you had some cool stuff on there as well.
Yes, I will.
Especially like the brain gut body connection. Definitely curious about that.
Mm-hmm.
So
Yes.
I mean, unless anyone that's on here has questions, we can go ahead and just end it there. Yeah, and everybody